Every year, millions of people are bitten by dogs. It happens quickly. One moment you're walking peacefully, the next moment you're injured. If you don't know what to do, a simple dog bite can become a serious medical emergency. Welcome to Nature Realms. In this documentary, we're teaching you exactly what to do if you're bitten by a dog. We'll cover immediate first aid, when to seek medical attention, infection prevention, and how to avoid serious complications like rabies. This information could save your life or the life of someone you love. If you ever encounter a dog bite situation, you'll know exactly what steps to take. Subscribe to Nature Realms now, and let's learn life-saving first aid. Dog bites are more common than most people realize. Every year, approximately 4.5 million people are bitten by dogs in the United States alone. That's one person every 7 seconds. Globally, dog bites affect tens of millions of people annually. Most dog bites are not life-threatening. They're painful and require treatment, but people recover fully. However, some dog bites can be serious. Large dogs with powerful jaws can cause deep puncture wounds, tissue damage, and severe bleeding. Even more concerning is the risk of infection. Dog mouths contain numerous bacteria, including Staphylococcus and Streptococcus. When a dog bites, these bacteria are driven deep into the wound. Nearly 1 in 5 dog bites become infected if not treated properly. The most feared complication of a dog bite is rabies. While rabies is rare in developed countries due to vaccination programs, it's still a real threat. Rabies is nearly 100% fatal once symptoms appear, making post-bite treatment critical. Not all dog bites are equal. Understanding the severity of your bite helps determine how urgently you need medical care. Bite severity depends on several factors: the size of the dog, the depth of the puncture, the location of the bite, and whether the skin was broken. Minor bites might be small puncture wounds or lacerations that don't break the skin deeply. These are painful, but often manageable with home first aid. Moderate bites involve deeper punctures or larger lacerations that may require stitches. These always need medical evaluation. Severe bites involve large, deep wounds with significant tissue damage and bleeding. These are medical emergencies requiring immediate professional care. Bites to the face, neck, or hands are particularly concerning because of nerve and blood vessel involvement. Bite location matters significantly. Bites to the face and neck pose risks of severe bleeding and nerve damage. Bites to the hands can damage tendons and nerves, affecting long-term function. Bites to the limbs are generally less severe than bites to the torso or head. Your first priority after a dog bite is safety. If the dog that bit you is still present and aggressive, your immediate goal is to escape further injury. Create distance between yourself and the dog. Move away slowly and deliberately. Do not run, as this may trigger the dog to chase and bite again. If you cannot escape, protect your vital areas. Curl into a ball if knocked down, protecting your face, neck, and torso. Do not look the dog in the eye, as this may be perceived as a threat. Make yourself appear small and non-threatening. Once you're safe from the dog, assess your physical condition. Are you bleeding heavily? Can you move all your limbs? Is there severe pain? These are important assessments that will guide your next actions. If the bite is severe with heavy bleeding, profuse blood flow, or signs of deep tissue damage, call emergency services immediately. Do not waste time with home treatment if you're seriously injured. Get to an emergency room as quickly as possible. For minor to moderate bites, begin first aid immediately. The goal is to clean the wound, stop bleeding, and prevent infection. Start by washing your hands thoroughly with soap and water. You don't want to introduce additional bacteria into the wound. Gently clean the bite wound with soap and water. Use a clean washcloth or gauze. Wash thoroughly, removing any dirt, saliva, or debris from the wound. This is crucial. Thorough cleaning dramatically reduces infection risk. If the wound is bleeding, apply gentle pressure with a clean cloth or gauze. Maintain pressure for several minutes until bleeding slows. Avoid pressing so hard that you cut off circulation. If bleeding is heavy and doesn't stop after 10 to 15 minutes of pressure, seek medical care immediately. After cleaning and bleeding control, dry the wound gently with a clean cloth. Do not rub pat gently. Rubbing can damage delicate tissue and increase bleeding. After cleaning, apply an antiseptic to prevent infection. Options include hydrogen peroxide, povidone solution, or antiseptic ointments. Apply your chosen antiseptic according to product instructions. Hydrogen peroxide is particularly effective because it removes bacteria and foreign material through its foaming action. However, it can slow wound healing if overused. Use it once or twice, not repeatedly. Povidone is an excellent broad-spectrum antiseptic that kills many types of bacteria. It's particularly useful if rabies is a concern, as iodine has some antiviral properties. Apply according to product instructions. Most dog bites heal completely within 2 to 4 weeks, depending on severity. Minor bites may heal in days. Deeper bites take longer. Scarring depends on bite depth and location. To promote optimal healing, keep the wound clean and protected. Avoid exposing it to dirt or bacteria. Use bandages appropriate to the wound's severity. Follow your doctor's care instructions precisely. Once the wound has closed, usually 7 to 10 days, you can begin scar management if desired. Silicone gel products, vitamin E oil, or professional scar treatments can improve appearance. Early intervention produces better results than waiting months. For severe bites that require stitches, ask your doctor about optimal stitch removal timing and post-stitch care. Proper care during healing significantly improves final scar appearance. Some scars fade naturally over months to years. Newer scars are more amenable to treatment than old scars. If scarring is cosmetically concerning, dermatologists offer laser treatments and other options. Dog bites can have psychological effects beyond physical injury. Many bite victims develop fear of dogs, anxiety in situations where dogs are present, or even PTSD in severe cases. If you experience anxiety or fear after a dog bite, know that these reactions are normal. Gradually reintroducing dogs in safe, controlled environments can help. Working with a therapist or counselor may be beneficial. Children who are bitten may develop lasting fear of dogs. Parents should help children process the experience and gradually rebuild confidence around dogs in safe settings. Professional help is available if fear persists. Do not minimize psychological effects. If a dog bite has significantly affected your mental health or quality of life, seeking professional support is appropriate and beneficial. If you were bitten by someone else's dog, identifying the dog is important for several reasons. You'll need the dog's rabies vaccination status. You may need to report the incident to local animal control. You might pursue legal action or compensation. If possible, get information about the dog, owner's name and address, dog breed and color, dog's name, and rabies vaccination status. If the dog is unknown, obtain descriptions from witnesses. Report the bite to local animal control. This creates an official record. It alerts authorities to potentially dangerous dogs. It helps protect others from being bitten by the same dog. If the dog's rabies status is unknown, animal control may quarantine and observe the dog for 10 days to determine if rabies is a concern. This observation period helps determine if rabies post-exposure prophylaxis is necessary. Dog bite injuries may result in medical expenses, lost income, and pain and suffering. Understanding your legal and insurance options is important. Contact your homeowner's or renter's insurance to report the incident and discuss coverage. In many jurisdictions, dog owners are liable for injuries their dogs cause. You may be able to recover medical expenses and other damages from the dog owner's homeowner's insurance or through legal action. Document everything: photos of injuries, medical records, medical bills, and any lost income. This documentation is crucial if you pursue compensation. Consult with a personal injury attorney if you have significant injuries or expenses. Many attorneys offer free consultations and work on contingency, taking payment only if you win compensation. The best treatment for dog bites is prevention. Understanding dog behavior helps you avoid situations where bites might occur. Never approach unfamiliar dogs without permission from the owner. Always ask before petting someone else's dog. Be cautious around dogs showing warning signs, raised hackles, bared teeth, growling, stiff posture, or direct staring. These are signs a dog feels threatened. Back away slowly and give the dog space. Teach children never to approach unfamiliar dogs and to ask permission before petting any dog. Teach children to remain calm if approached by an aggressive dog, to back away slowly and not run. Avoid cornering dogs or blocking their escape routes. Dogs bite when they feel trapped. Always give dogs an exit strategy. Do not tease dogs or take away their food, toys, or puppies. Do not wake sleeping dogs suddenly. Do not approach dogs that are protecting their owners or property. If you have a dog, ensure it's properly trained, socialized, and up to date on vaccinations. Secure your dog to prevent it from escaping and biting others. Report dangerous dog behavior to authorities before someone is bitten. Dog bites are common, but most can be successfully managed with proper first aid and medical care. The key is knowing what to do immediately after a bite and seeking professional help when necessary. Remember, clean the wound thoroughly, stop bleeding, apply antiseptic, and bandage appropriately. Watch for signs of infection. Seek medical care for deep bites, heavy bleeding, or unknown dog status. Get rabies prophylaxis if the dog's vaccination status is unknown. The vast majority of dog bites heal completely without complications. By following proper first aid and medical protocols, you can ensure optimal healing and avoid serious consequences. There you have it, the complete first aid guide for dog bites. From immediate response to wound care, infection prevention, to knowing when to seek emergency help, you now have the knowledge to handle this common emergency. If this video could help you or someone you love, please like and subscribe to Nature Realms. Share this video with family and friends, especially those with children or who spend time around dogs. Your sharing could help someone avoid serious complications from a dog bite. Have you ever been bitten by a dog? Share your experience in the comments below. What did you do? What would you have done differently? Comment and let us know. Thank you so much for watching Nature Realms. Knowledge is power, and now you have the power to handle dog bites safely and effectively. We'll see you in the next video. Stay safe, and thank you for being part of our community. Antibiotic ointments like Neosporin or bacitracin are also effective. These create a barrier that prevents bacterial entry while promoting healing. Apply a thin layer and cover with a bandage if desired. Do not use hydrogen peroxide if the wound is very deep or if you suspect it penetrates into muscle or body cavities. In these cases, professional medical care is necessary. After antiseptic treatment, bandage the wound appropriately. For small, shallow bites, a simple adhesive bandage may be sufficient. For larger or deeper wounds, use sterile gauze and medical tape. The bandage serves several purposes. It protects the wound from dirt and bacteria. It keeps the wound moist to promote healing, and it prevents accidental re-injury. Change the bandage daily or if it becomes wet or dirty. Signs of proper healing include the wound becoming less red over days, pain decreasing, no pus or discharge, and new skin beginning to form. Most minor bites heal within 2 to 3 weeks. If the wound shows signs of infection, increasing redness, pus, foul odor, swelling, or warmth, remove the bandage and seek medical care. Infection requires professional treatment. Certain situations require immediate professional medical attention. If you experience heavy bleeding that doesn't stop after 15 minutes of pressure, go to the emergency room immediately. Do not delay. If the bite is deep or large, causing significant tissue damage, seek immediate care. Deep bites may require stitches, and only a doctor can properly assess wound depth and tissue damage. If you experience signs of shock dizziness, rapid heartbeat, pale skin, weakness, or confusion, call emergency services immediately. Shock is life-threatening and requires professional medical intervention. If the bite is to your face, neck, hand, or genital area, seek medical evaluation even if it doesn't seem severe. These locations have important nerves, blood vessels, and tendons. Professional evaluation is important. If the dog that bit you is unknown, unvaccinated, or rabid, seek immediate medical care. Rabies post-exposure prophylaxis is time-sensitive and must be administered as soon as possible. Rabies is a viral disease transmitted through saliva. It's nearly 100% fatal once symptoms appear, but it's 100% preventable with prompt post-exposure prophylaxis. Understanding rabies risk is critical. If you were bitten by a dog whose rabies status is unknown, assume the worst and seek medical care immediately. A series of rabies vaccines can prevent the disease, but they must be started as soon as possible after exposure. Rabies symptoms in dogs include excessive drooling, unusual shyness or aggression, sensitivity to light and sound, and paralysis. If the dog that bit you shows any of these signs, seek medical care immediately for rabies prophylaxis. The rabies vaccine series is no longer the painful abdominal shots of decades past. Modern rabies vaccination involves 4 to 5 shots in the arm over 2 to 3 weeks. It's uncomfortable, but absolutely life-saving if you've been exposed. If you can safely capture the dog, confinement and observation for 10 days can determine if rabies is a concern. Dogs with rabies typically show symptoms within 10 days. If the dog remains healthy, rabies risk is minimal. Infection is the most common complication of dog bites. Watch for signs of infection in the days and weeks following a bite. These include increasing redness around the wound, swelling, pus or discharge, warmth to the touch, and increasing pain. Systemic signs of infection include fever, chills, swollen lymph nodes, and general malaise. If you develop these signs, seek medical attention. Infected bites require antibiotic treatment. Prevent infection by keeping the wound clean and dry. Change bandages daily. Wash the wound gently with soap and water during bandage changes. Avoid exposing the wound to dirty water or environments. Some doctors recommend prophylactic antibiotics for certain types of bites, particularly deep puncture wounds or bites that occurred in contaminated environments. Ask your doctor if prophylactic antibiotics are appropriate for your specific bite. If infection develops, antibiotics can usually treat it effectively. Common choices include amoxicillin clavulinate or fluoroquinolones. Take antibiotics exactly as prescribed, completing the full course even if you feel better. When a dog bites, a dirty, bacteria-laden object, the dog's tooth creates a puncture wound. This creates conditions favorable for tetanus, a serious bacterial infection. Tetanus prevention is important after dog bites. If you have not had a tetanus booster in the last 5 years, and you're bitten by a dog, ask your doctor about a tetanus booster. Tetanus is rare in vaccinated populations, but potentially deadly if it develops. The tetanus vaccine is safe and routinely given. Many people receive it as part of the diphtheria pertussis tetanus DPT vaccine or as a standalone tetanus booster. Getting a booster after a dog bite is reasonable preventive medicine. Dog bites are painful. Managing pain appropriately helps you function and promotes healing. Over-the-counter pain relievers are usually sufficient for minor to moderate bites. Ibuprofen and naproxen reduce inflammation and pain. Acetaminophen reduces pain but doesn't address inflammation. Either can be used according to package directions. Avoid exceeding recommended doses. For more severe pain, your doctor might prescribe stronger pain medication. Use prescribed pain medication only as directed. Do not exceed doses or continue use beyond the recommended duration. Ice applied to the bite can reduce swelling and pain. Apply ice for 15 to 20 minutes at a time, several times daily. Wrap ice in a cloth to avoid direct skin contact. which can cause damage. Elevation of the bitten area reduces swelling. If bitten on the hand or arm, keep it elevated above heart level when possible. If bitten on the leg or foot, keep it elevated while sitting or lying down.